Good afternoon and welcome to the regular meeting of the Public Health and Safety Committee for October 11th, 2023. I am Latricia Vital and I am the chair of this committee. At this time, I will ask the clerk to call the roll so we can verify a quorum for this meeting.
Councilmember Wansley.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Payne.
Present.
Chair Vita.
Present.
There are 5 members present.
Let the record reflect that we do have a quorum. With that, the agenda for today's meeting is before us. There is one item on today's consent agenda. The item is authorizing an increase to the contract for service between Special School District Number 1 and the Health Department for Mental Health Services. Is there any discussion on this item? Seeing none, I will move for approval of the consent agenda. All those in favor, please say aye. Aye. Any opposed? Nay. That carries and the consent agenda is approved. The next item is receiving and filing the 2022 Neighborhood Board Representation Survey Report and the 2022 Advisory Boards and Commissions Board Representation Survey Report. Is there any discussion on this item? Seeing none, I will direct the clerk to file those reports. The next item is receiving an update on the Community Commission of Public Oversight. I understand that this needs to be continued. I will make a motion to continue this item to the Public Health and Safety meeting on October 25th. All those in favor, please say aye. Aye. Any opposed? Nay. That carries and will be moved to October 25th. I am sorry to anyone who showed up for that item on today's agenda. The next item is an item sent back to the Public Health and Safety Committee for further discussion. The item is accepting a grant from the U.S. Department of Homeland Security to implement prevention strategies for countering violent extremism using public health methods. This item was on the consent agenda. At the last PHS meeting, it was approved and forwarded to council. At council, I move to refer this item back to the committee for additional discussion. And we have Tony Hauser here with us. Please, thank you. Welcome back. At this time, I'm going to ask, is there any discussion on this item? Councilmember Wansley.
Oh, I wasn't sure. Is staff giving a presentation or a report back first?
Do you have a presentation?
I have a presentation.
Okay, all right.
Which I'm hoping will answer a number of questions.
All right, thank you.
But first of all, I want to thank you, for having me back, and I'm sorry I wasn't available last week. And I want to start by acknowledging the concerns that were voiced last week. That there's been a lot of harmful counterterrorism work done in and to our communities of color at all levels of government, and ignoring that history really perpetuates the stereotypes that continue to persist. So as a resident of Minneapolis, I appreciate and thank you for speaking up on behalf of your constituents. So I thought I'd start by providing an overview of the Center for Prevention Programs and Partnerships, or CP3. This is the organization in the Department of Homeland Security that provides this grant fund. And in DHS, they're housed, it's the red box, and I know that these are very small pictures, but they're housed in the Office of Strategy, Policy, and Plans. And they also are very connected with the Office for Civil Rights and Civil Liberties, the Privacy Office, and the Office of the General Counsel. And those offices are involved in every aspect of CP3's mission of prevention. And those are the boxes outlined in yellow. Included in that, in the yellow boxes, I also have the Cybersecurity and Infrastructure Security Agency highlighted, along with the Federal Emergency Management Agency. Those two groups also partner with CP3 on a lot of this work. So the work that CP3 does is public health informed, and they're guided by violence prevention principles that were developed by the Centers for Disease Control and Prevention. The focus is on locally led prevention efforts because they're the best approach, and also focusing on local efforts to establish and enhance that local prevention work. So some of the main areas where they do that work is in awareness and training. They have briefings that they deliver, and then they maintain a catalog of other available trainings that are produced by local, state, and federal partners. They also convene and engage partners and stakeholders by providing direct technical assistance and then engaging stakeholders across all disciplines. Coordination is a big piece for their office, connecting partners, in order to do a lot of this previous work. But then also evaluating programs and ensuring that programs or other promising practices reach other communities and they don't just stay in that silo. And then the final one is the grant administration, so the funding of local prevention programs. And so that funding is the Targeted Violence and Terrorism Prevention Grant. And I want to tell you what this grant isn't. The CP3 office, as I mentioned, is focused on prevention. So it's a very limited scope. What this grant is not meant for and can't be used for is surveillance, profiling, and I have law enforcement. Law enforcement is involved, but this isn't a grant where we are enforcing laws. And as such, we have nothing to do with immigration. There's not any reporting that goes back to any immigration agencies, and also Minneapolis is a welcoming city, and our team in the health department takes that designation very seriously. This also, the grant is meant to fund local programs, and as such, there is no federal operations happening as a part of this work. So what it is, it's informed by public health, which, we'll get to the public health connections in a minute. And it's funding that is provided directly to state, local, tribal, and territorial governments, nonprofit organizations, and higher education institutions. And it is meant to address all forms of targeted violence, so that includes white supremacists, it includes anti-government groups and militia, lone offenders. So it includes all of the groups that would fall under one of the, unfortunately, many categories of targeted violence. And then the assistance, the financial assistance is meant to provide sustainable and multidisciplinary prevention capabilities for local communities, also to pilot innovation prevention approaches, and to identify best practices that could be replicated in other communities across the country. And then I want to provide a little context for this grant. And I will say that I learned about this grant earlier this year, shortly before the grant deadline. And so I've done a lot of digging into it, and I wouldn't normally say that about a lot of federal grants, but this one I find kind of fascinating because the organizations and the projects that have been funded with this grant are some of the most diverse that I've seen for this type of work. And so I pulled some of the data from the website, and the website is listed on there. So this is all information that's available to the public. And since this funding started in 2020, so this is the fourth year of funding, you'll see that the bulk of the funding has gone to nonprofit organizations and higher education institutions. That's the bulk of the actual funding, and the number of organizations that have been funded also fall into those two categories. So I thought that was very interesting because you can see the list, on the website, you can see what they're working on, but just having, I like pictures. And so this provided, a pretty comprehensive picture of what the priorities are of this office. And what I think is interesting is local government. I think there's, that's on the number 4 line. So 2023 is the first time that this grant has been awarded to an organization in Minnesota. There's also a state level organization that has also received a grant award. But out of all of the recipients since 2020, the Minneapolis Health Department is the first public health department to receive this funding, which I was a little bit surprised when I was looking into this, knowing that their approach for the entire program is based on public health principles. But part of the reason why we were encouraged to apply for it was because of that connection, and because some of the previous work with the Office of Violence Prevention, which is no longer in the health department, but the health department having a history of doing violence prevention work in our department. And so in addition, I just wanted to show some of the breadth of some of the organizations that have been awarded this funding. So it's, a lot of nonprofits and academic institutions, but it's, even among those two groups, it is a very diverse mix. So now I'm going to talk briefly about the grant proposal that we submitted back in May, I believe that was. So one of the Minneapolis 2040 goals is around healthy, safe, and connected people. So in 2024, I'm sorry, not 2024, that's next year, 2040, the people of Minneapolis will be socially connected, healthy, and safe. And this goal is supported by all of these policies that are intended to guide our decision-making in the city. And addressing violent extremism using a public health-informed approach means implementing programming before radicalization or violent action takes place, and also typically benefits other areas of society, such as education and community mental wellness. So from the perspective of public health, this can be thought of as primary prevention, which aims to prevent disease or injury before it ever occurs. And to inoculate against violent extremism, it's important that we develop healthy, resilient, strong communities where it's hard for violent extremism to take root. Knowing that connectivity and community have prevented violent extremism in other contexts, this is a strategy that we're proposing to use in our community against to prevent violent extremism and violent acts from taking place. And so programming will use a public health prevention approach to prevent and mitigate violent extremism by increasing protective factors like social cohesion, providing knowledge and skills to enable self-efficacy for bystander intervention, and then in order to raise societal awareness of risk and protective factors for violent or active threat actors, we plan to design a training curriculum that will be delivered to community members, ideally in partnership with community-based organizations with whom we already have relationships. And then for bystander intervention training, we'll provide response-oriented actions, such as when and how to alert authorities. By adapting programming from existing curriculum, we can present a comprehensive overview of actions available to community with which to effectively intervene and minimize harm from violent extremist actions. And the health department's model for public health is that the community is a part of our public health system. This means that we do our work in partnership with community across all areas of preparedness and build relationships over time. We have an engaged community that wants to succeed and is used to partnership to make it happen. All community stakeholders have a whole and an effective response to active threat events, and therefore should be engaged in prevention, preparedness, and mitigation activities together with us. So it's our intent for this program to be available citywide with an initial focus on the communities that were highlighted in the race and equity impact analysis. The East Phillips and Ventura Village, Central Bryant, and Near North communities are all hosts to resilience hubs, which is another project in development. In addition, 2 of those areas are also designated as cultural districts, and 2 are located within green zones. We also want to ensure that contexts like poverty, home languages other than English, and disability are taken into account. And I want to be clear that we're not focusing on those parts of the city because we think the people who live there are more likely to become radicalized. Rather, we want to learn from those communities about their concerns and what they need in order to be safe. And as an example, earlier this year, my team had the opportunity to meet with staff from LGBTQI+ serving organizations. And through those conversations, we learned a lot about what keeps them up at night. Safety of gatherings and events, training staff on de-escalation, having knowledge or intelligence about potential threats, how to handle bomb threats, and unfortunately, what happens if there's a mass shooting like what happened at Pulse nightclub in Florida or Club Q in Colorado. And so that has been one of the themes in my head thinking about this work is we want these communities to understand threats that are possible in their community and to the members of their community. And we want to make sure that they know what they can do if they see something, who to go to for help. But we also want to prevent it even getting to that point. So working with other groups who, might not be familiar with working with certain individuals or in certain situations. So providing education, and I'm definitely getting ahead of myself. So delivery of awareness and bystander training activities. We want to do that within our existing relationships with the Resilience Hub host sites and community partners, in addition to building more connections with other community-based organizations and community members. And training offerings would be made to all of those groups I already mentioned, as well as neighborhood associations and councils, educators, the general public. That is part of the proposal that does not have a lot of detail because it was dependent on developing those activities after the grant award. But I did want to just point out a few of the activities that we included. And our activities focus on educating community members and stakeholders on the risk and protective factors for violent extremism and promoting knowledge and skills for prevention and intervention. So we mentioned community events. So those would be designed to include a combination of educational sessions, focused programming, and awareness-raising activities. And they can include activities such as information-sharing forums, dialogues between community members and law enforcement, multi-faith gatherings, and awareness-raising sessions in conjunction with other partners. And the purpose is to promote an open forum engagement in order to gather feedback and facilitate dialogues regarding community protective factors and risk factors, and identify vulnerabilities to targeted violence and terrorism. So the community events, we're hoping, would facilitate information sharing, increase trust and confidence, raise awareness on extremist threats and indicators, build social cohesion, and strengthen community partnerships. And also, provide an opportunity for community leaders to connect, organize, and drive community groups towards long-term, sustainable, and creative solutions to work to prevent targeted violence and terrorism. And so with that, I am happy to answer any questions.
Councilmember Wansley, thank you for the presentation.
Thank you, Chair Vita. I will thank you for bringing the presentation. And also I know Deputy Commissioner Heidi Ritchie also sent an email to council members in the past couple of days, basically recapping what was included in the RCA about what this grant would be used for, and which demographics would be the kind of primary targets of this grant. So thank you for rehashing basically the information was part of the RCA that I think some council members had not had the opportunity to see. What I will name that is still concerning is all of us heard several council members of color, primarily council members who are Muslim, who have seen their communities be victimized by CVE, which is the Counter Violence Extremism Program, and have highlighted the very grant that we're being asked to consider is a rebranded version of that. And while it's not coming through federal agents, it's being used as a softer approach through nonprofits, which through CVE, and as those council members name, young people of color, Muslim people of color, went into these safe spaces, nonprofits, not knowing that they were being watched and observed to see if they were quote unquote hitting the indicators that you mentioned. That's going to also be part of this grant, and not knowing that that would lead some of them to face terroristic charges when they thought they were going into safe spaces in their communities. So while the approach is different, the goal is still the same. And it's somewhat contradictory to say we're going to predominantly communities of color that have expansive Muslim community and say that we're going to try to do preventative, work to keep you safe, but use a program that we know has caused lasting and generational harm to your respective communities. We're going to use dollars that did that. So I take the sentiments that my colleagues share very deeply. I know many folks who have seen their loved ones be targeted because of grants like this. And it's very concerning that still as a city, we're looking to double down on using this and trying to frame it as best as we can through a public health approach and all those things. It still is a rebrand of a grant that has caused tremendous harm and that has targeted very specific communities in our city that does not align with this mission that you highlighted of our city feeling inclusive. It can't feel inclusive when folks feel like they're being watched. It also, in the presentation, or RCA, did not include substantially how white supremacists, for instance, or white supremacy or right-wing extremism will also be targeted through this grant. There was an asterisk in, the presentation, but it's very clear the key demographics will be predominantly BIPOC folks, and it will be in areas, as you identify, that are primarily represented by BIPOC folks. So for those reasons, it feels like there has not been openness towards really interrogating the background, the harm that this grant has caused, even in its rebranded version. And for those reasons, I still can't support it today. So I at least wanted to share that and reiterate that for my constituents and for constituents who would see the city approve this and think why. So thank you for the presentation, but wanted to state that for the public record.
Thank you, Councilmember Wonsley. Vice Chair Payne.
Thank you, Madam Chair, and thank you for the presentation. Yeah, I'll echo some of my colleagues' sentiments. I'll first say that at face value, this all felt very good to me, and it was only in speaking to my colleagues, especially my Muslim colleagues, that really were elevating their concerns, and those really had an impact on me, and it's just making me think of the recent decision of the Biden administration to continue building the border wall. And it's just a reflection that just because the political party in charge changes doesn't necessarily mean the momentum of some of those initiatives are fundamentally changing. And whether that's the border wall or Title 42 or the work of Homeland Security. And I think those stories, especially those really personal stories, and I'm thinking about Councilmember Chugtai, because she is of the generation that's been kind of ground zero for some of these anti-terrorism efforts. It is just really, really challenging for me to listen to those stories and see things like Title 42 or the border wall continuing. Even though we all want to celebrate the end of the Trump administration, it doesn't necessarily mean the end of some of those practices. And so that's the thing that gives me a lot of pause.
Thank you. Any further discussion? Councilmember Ellison.
Thank you, Madam Chair. I think one of the things that stuck out to me after the first presentation, because again, obviously we want to be countering extremist behavior, at face value, sounds like an admirable goal. But can you just relist the neighborhoods of focus? I know that Near North was mentioned. What again are those neighborhood areas of focus? Because that was the thing that sort of lingered with me as a red flag after the last committee.
Yeah, thank you, council member. To the chair, I think that's maybe one of the pieces that we haven't been clear about. So it's Near North, East Phillips and Ventura Village, and then Central. I have to look at my notes, but around Sabathani Community Center. And so those three areas are all hosts to Resilience Hubs, which is another project on my team. And so the reason why those areas were included in the RIA and in the grant is because they are host sites for our resilience hubs. And so a space for us to provide programming in partnership with trusted community organizations. And so our intent is we're not targeting people who live in those communities. What we're trying to do is, and this kind of ties into the Justice 40 initiative, is provide programming and opportunities in these areas, which I know 38th Street has been designated as a Justice 40 community. So we're trying to, focus funding and opportunities and programming in those areas. So it's not, our intent is not to invite people in and then teach them how to, be afraid of their neighbors or, who to call the FBI on. What we want to do is find out what are their concerns. What unfortunately keeps you up at night? Like what are the threats to you, either in this community or elsewhere? And then using that to provide some education about different hate groups, because knowledge is power, and being able to differentiate from one from the other is sadly helpful. But then also, and this grant doesn't get into the the response piece or preparedness, which we really had to pull back on in our application, because that's normally kind of what we go for. But to provide some training to the people in those communities, but then also, depending on what was, the feedback that we learned from them about what they're concerned with, depending on who it is, who the groups are, reach out to them to provide other training or connect them, with other programs through the CP3. So I hope that is helpful.
It's definitely helpful. I hope that you can appreciate how, when you've got a lack of trust in community combined with the history of this program, how naming those geographic areas it makes it sound like those geographic areas are the targets of these grants. One of the things that I'm trying to wrap my mind around is what would be the practical application, right? So, for example, in looking back at a lot of the critiques, because I had to revisit some of the critiques of the old CVE program, there's one thing that kept coming up was there's a lot of research that says, look, you can go and find a lot of people with extremist views. 99% of them are never going to manifest those views in violence, right? So But so let's say hypothetically under this program, you've got a young person who, for whatever reason, they've gone down a rabbit hole on the internet. They've confided in a mentor who's a staff person here, that in some ways they are signifying that they're developing extremist views. Mm-hmm. Do they end up on a DHS list? Do they end up on an FBI list? What's the level of surveillance or not surveillance that you can ensure or that you kind of have knowledge of when it comes to the administration of this program?
Yes, thank you for that question, Council Member, and to Chair Vita. There's no surveillance. Even though the money is coming from a federal department, and there are responsibilities for reporting on grant duties, there is no surveillance. I will say that it's the health department, so we don't really have the capacity for surveillance. But also that's out of the scope of prevention work. And looking at the previous countering violent extremism work, I mean, that was just one of the many things that was harmful to the community. And because we know from data that someone could have a number of risk factors, but that does not mean that they're going to act on it. So really that surveillance piece isn't effective. It's more harmful than it is positive. So there is no piece of surveillance in this program. There's no reporting on who participated and in what groups. I think that if there was a situation like the example you provided, a lot of the other organizations who have received this funding have developed training or resources or online games specifically for that purpose. So if someone, if we see someone who's kind of going down that road and we want to help them, steer onto a different one, we have tools available, to help, educate them or show them other ways. So again, it's prevention. It's not, we're just going to keep letting you do your thing and maybe something happens.
Thank you. And sort of my last bit, again, because it's been many years since that original CVE program. I don't remember, this is just from my own personal experience, I don't remember surveillance being an explicit part of those programs either, but in the wake of everything, and as years went by, it became sort of apparent that was a part of it. And so, I guess just for the sake of clarity and just so maybe I'm not getting, maybe I'm getting my sort of memory wrong, but was surveillance an explicit part of those programs? Because if it wasn't, and it ended up happening anyway, I think that kind of goes a long way in, the kind of trust we can ask, right? Anytime we're up here voting on things, we're representing folks. I think about the messages in my ward who are looking and saying, okay, what kind of reassurance can we get? And anytime we vote on anything, we're sort of asking the community to trust us on that. I think that this sort of speaks to that. And so was surveillance an explicit part of the earlier programs? I guess that's the question.
Yeah, and Councilmember Ellison and to the chair, I don't know. That was a little bit before my time here. But I think the main difference is the countering violent extremism programs were federal programs that were operated by federal agencies. And so with this, it's, we're getting the funding to operate, the program that we've proposed. And, we have some federal partners as resources and for technical assistance, but, unless there's a specific need or, a presentation or something like that, there's not an expectation that the federal agencies are involved in this. And then I will just say, I grew up on 33rd and Portland, and now I live just off of Lindale and Lowry. So, I've spent a lot of time in these areas, and so this, for me, this kind of work isn't just like, okay, let's go get another grant. It's really important work that I think that our department and our team has a really unique perspective to address. And, you're talking about trust, and I am very committed to this city. Haven't found anywhere else that's, worthy of moving to. And so, my hope is that you all, trust that we are committed to this work and committed to doing it right. And what we can also do is, I don't want to speak out of turn, because with all the legislative directive changes, maybe I'll say something wrong. But, if there is an opportunity, to have council office involvement in some of these activities or gatherings, or to serve as a conduit for information, this type of work is something that, we would welcome all sorts of partners.
Thank you. And I don't have another question, but I'll just sort of say that I do appreciate that. I appreciate the answers to my questions. I think, it's certainly reassuring to get the level of due diligence and from you, and that is reassuring. And I think that, sort of the weight we have to give is, how much can we expect the community to trust sort of the individual due diligence versus this sort of precedent that's been set. And I'm glad that you brought trust back up, because I think that it can be really easy for me as a council member to trust you as a staff person that you've done your due diligence. I think that, the question's a little bigger though, whereas can I ask my community sort of more broadly to trust this institution broadly, and that's sort of the thing that gets more difficult, and so that's, I think, why you see council members wrestling with this. It's not a sort of an individual gripe with your due diligence. I think your due diligence here is appreciated, and thank you for coming back to committee to address it. But those are the things that we have to weigh when we're asking our questions and determining how we're going to vote. So I do appreciate it.
Thank you, Councilmember Ellison, and I want to thank you again, Director Hauser, for coming back to committee. I know that we approved this in May. I was really excited as a council member when you sat down with my office and explained to me what you were going to go after when it got approved the first time. Well, when it got approved for you to apply for the funding, and so. I was excited when it came back to committee and we were able to speak a little bit more in detail with the health department about how this was going to be in the community. I respect and appreciate the concerns of my colleagues, but I felt good about it the last time it was in committee. I thought you did a great job at answering concerns that I had and other council members had, and I understand where there's some hesitation from other council members, but I just wanted to acknowledge that you have been working on this in May and we approved it, and I'm excited to support you. You made a comment that was just super sweet. You just said, we have to trust that you're committed to this work, and I do. I believe you're committed to this work. You live in this community. You just said you love Minneapolis. You wouldn't even live anywhere else. So I do understand your commitment, to this work and to this community and trying to make it better. So thank you for doing that. And I really believe in the prevention methods, especially the public health approach to prevention. So I don't know how this is gonna turn out. You know, I sent it back to committee because it wasn't gonna pass, and I don't know what's gonna happen, but I want you to keep at it and, you know, continue to bring your ideas and your department's ideas in front of committee, and we'll make sure that we keep a close eye on them in the beginning. And again, I don't know how it's gonna turn out, but I support you. Thank you.
Thank you, Madam Chair.
Any further discussion? Councilmember Payne.
I know that some of the other, thank you, Madam Chair. I know some of the other council members may have wanted to weigh in. Obviously, these are open for anybody to participate in, but I'm wondering if it would be beneficial for us to forward this without recommendation so that those council members do have that opportunity.
Absolutely. We can take a vote on, Councilmember Palmisano, thank you.
Yeah, thank you. Thank you, Councilmember Payne, for that suggestion. I, after hearing my colleagues express concern at full council last week, I felt like maybe there was an opportunity here to really change the lens through which we see some of these grants, right? Like how we are considering them. You've given me reassurance and comfort that we're approaching these the right way from the city level. And I know that we're very careful when we go about this kind of work at the city level. I think it certainly takes leaders in our city to also support it and to be there with you in that effort. So I would appreciate that little bit of extra time because I'd like an opportunity to check in with some of those other colleagues as well. So thank you for that suggestion.
Thank you. Councilmember Ellison.
Sorry, I was actually just like being a busybody over here and didn't mean to put my tag up. But I probably wouldn't be so prepared to support this today, but I do want us to continue conversation and to have some of my other colleagues be able to ask questions at Cal or full council. And so I would support moving forward without recommendation today. So.
Thank you. So I'll move forward with taking a vote on moving it forward without recommendation. All those in favor, please say aye. Aye. Any opposed?
Nay.
One nay. That carries, and this item will be forwarded to next week's council meeting. Thank you. And seeing no further business before us, I will declare this, I'm sorry, Councilmember Ellison.
Would I be able to vote affirmatively for the other items that I believe I walked in during discussion?
Yep.
Great.
All right. Thank you. Seeing no further business before us, I will declare this meeting adjourned. You're great.
Happy to.